Go.
So our slide presentation is on stress, and this is by Brittany Waters, Jennifer Sherrod, and Tamika Brown. The objectives of this presentation is to identify and understand types of stress, to identify and learn models and theories related to stress, use of evidence-based practice models related to stress, develop preventive strategies related to burnout and compassion fatigue, identify coping strategies, nurse retention strategies, and decrease in mental health and substance abuse. Next. So the introduction to stress management. What is stress? So stress is an adaptive response to a stimulus to protect oneself from harm. And this is coming out of Sullivan, our chapter 26. So there's good stress and bad stress. Good stress would be you're being chased down the road by a bear and your fight or flight kicks in. Your senses are heightened and you quickly decide your escape. Adrenaline gives you the ability to run faster and think faster, and hopefully you get away from the bear and doesn't cause any harm to yourself. But bad stress is when you are continually introduced or reintroduced to feelings over and over and over again that are causing you anxiety and increased pressure and that kind of thing. So if you come into work every day and you feel like you don't have enough staff, you don't have enough equipment to do your job, you feel unappreciated, lack of empowerment, you don't feel rewarded, you don't have time to take breaks or eat lunch and refuel and recharge your batteries. Vacation time is few and far between. If you're also on top of your work schedule, you're a parent, you're a nurse, a wife, a student, you're burning the candle kind of at both ends. So stress comes with negative physical, emotional, and psychological effects. You start to dread to come to work. You think of a different profession. You might feel unmotivated, which can lead to depression, anxiety, compassion fatigue, burnout, substance abuse, and physical illness. Next slide. So some of the key issues that we want to talk about is stress and burnout. So an article by Medeiros de Oliveira describes burnout as a continuous exposure to work stress related to poor working conditions, decreased job satisfaction, and ultimately work performance. Research was done on the prevention of burnout syndromes on nurses, and they used materials like to study, like using yoga, meditation, cognitive therapy, skill training, Reiki, healing touch, therapeutic massage. These results were effective in reducing stress and burnout. So 2020, this year we have been faced in the medical field with so many problems related to COVID. Nurses are facing staffing shortages. We are having increased patient loads, increased acuity. We have less resources, bed shortages, increasing mental and behavioral health crisis patients to make things even more difficult. Nurses are beginning to show the signs of stress and anxiety, worry, feelings of guilt, not being able to do enough. Morale is decreasing on many units. It's really important for leadership to understand the challenges being faced and execute plans to alleviate stress. The American Nurses Association actually has a code of ethics that says that nurses must take personal responsibility for our healthy lifestyles, including eating right, getting enough sleep, exercise, and socialization. And our self-care actually does affect patient care. Next slide. So before I go on talking about this next slide, I want to tell you, I had a very wise nurse tell me one time, explaining the burnout and compassion fatigue that happens to nurses. And this particular scenario has never left me. Um, so she equated it to finding a really nice pair of shoes. And you know those shoes are going to match every outfit. They're just going to look super cute. You go to put on those pair of shoes and you go to work all day. Well, after a little bit of time, that pressure of your shoe starts to wear on your foot, and it starts to build a reddened spot on your toe, and your toe hurts. Well, you continue to wear that shoe. Eventually, that reddened, painful place then becomes a blister. That blister, if the pressure is not relieved, the blister eventually opens and you have an open wound that's very painful. If you continue to wear those shoes, eventually that sore is going to heal eventually, and you're going to build a callus there. And that callus is your body's way of protecting you um, from the pressure and the stress of those shoes. This is what happens with nurses. We get out of nursing school, we are shiny, we're new, our hearts are full, we're compassionate, we are excited to join the profession. And then the profession starts to hurt. And we eventually build, a defense mechanism to deal with that. And that's what leads us to compassion fatigue. We literally get a calloused heart. So how do we combat that? How do we decrease the effects of burnout and compassion fatigue? So rounding, and when I speak of rounding, I don't mean rounding on our patients, I'm talking about rounding on our staff. Leadership rounding is really a very effective way to offer, so nurses and teammates can offer suggestions to leadership about how to improve the challenges that we face in the workforce. Sometimes leadership, they tend to get in their own little world and they forget about what's happening at the bedside in the workplace. And so sometimes it's really effective if we can talk about our concerns and have them actually, be a listening ear and try to find solutions. The other thing about rounding is there is a group that started a study in Boston. It was called the Schwartz Group, Schwartz Center for Compassionate Healthcare. And they developed a Schwartz rounding, which is like a debriefing after traumatic events that happened in primary and secondary stress-related events. And they mostly looked at this in emergency room and intensive care settings. These rounds follow the traumatic event, and they're usually led by pastoral care. And they're used to debrief and offer other services needed for staff, to alleviate some stress that happened at that particular time. So that's been a really good beneficial thing in a lot of units that have tried this. Moving on to holistic care, stress management and preventing compassion fatigue and burnout has, of course, been a hot topic for many years now. Atrium Health some years ago came up with a Code Lavender team, and those Code Lavender teams are made up of nurses, pastoral care, massage therapists, and they're all there to provide a holistic approach directed at combating compassion fatigue and burnout, and utilizing many of the strategies that we've already talked about. So COVID-19 has created some difficulties in using some of these therapies like massage and the being all in a room talking about issues together, just because of the socialization and distancing guidelines. So Code Lavender teams are coming up with new and different innovative ways to help decrease stress throughout the hospitals. Next slide. And then leaderships and organizations, we'll go back to this a little bit too. Organizations need to listen and respond to nurses' recommendations and implement plans where appropriate. The leaders need to realize that nurse burnout affects patient safety. Leadership should find ways to empower nurses, support nurses, and restore leadership. They need to be transparent so nurses can visualize their importance in the organization. And teamwork and collaboration is the heart of nursing. Leaders should encourage nurses to speak out for needed change within the organization and find mentors to mentor nurses to encourage, the purpose and joy in nursing again.
The book talked about different parts of stress, and it first started talking about how the nature of stress. The nature of stress is a balance between what the stressful situation and the capability of what you as a person can handle. So it defines stress as carrying a load on one's shoulders, bearing a heavy burden. Stress can lead, like to Jennifer said, physiological and psychological problems if your equilibrium of the degree you can handle and the amount of stress that is actually present is not equal. And then also we need to think about our patients, like how pain is subjective of what they tell us. Stress is subjective to what someone tells us as well, because everyone views different scenarios in different ways. And so one scenario you could be stressed like a 10 out of 10, whereas another scenario, you might not see it as stressful as someone else. Causes of stress, there's 3 different causes of stress. There's the organizational factors. So those are the ones that are job related. So like the task overload, the understaffed, the tasks that you can't really perform that easily, or you don't know how to perform the task because of the lack of knowledge. Or it could also be the environmental factors in the organizational factors. So like the alarms going off, the lighting, the noise, if you have unpleasant work peers who just kind of stress you out sometimes, those are all coming from a workplace. So that's the organizational factors. Then you also have interpersonal factors. So those are strained relationships that are within an environment that can provoke stress. So the relationships that you work with the same person every day, but your relationship might not be the greatest with them. So that causes stress to happen. And then there's also individual factors that you have personal stress that, such as, life-changing, marriages, pregnancies, moving, big jobs, big new purchases, things like that are all the individual factors that can cause stress. It also talks about the consequences of stress, kind of going off of what Jennifer said. Again, it talks about the psychological and the physiological responses. So if you don't take those warning signs, then you can deal with anxiety, depression, mood changes, perfectionism, and then you can be stressed so much that it can lead to actual physical illnesses. Also, the consequences of stress can be burnout, like Jennifer said, compassion fatigue, where you really don't have the compassion you used to care for your patients, and you really have the attitude of you don't care anymore. And then also post-traumatic stress disorder, where you're just so stressed out that the littlest things can trigger you to go into like a new mood, a new mindset. Managing stress, you can either use you need to find like personal methods. So like recognizing your stressors is the number one thing. So recognize what makes you so stressed out. Keeping, that equilibrium, like I said, life in balance as much as possible. And then define your role and stick to your role definition. So make sure like if you're stressed at work, know your role definition at work. If you're stressed at home, know your role definition at home. And then try to see what you're not doing to meet the requirements of your role definition. Caring for yourself physically. So make sure that if you love to work out. If you like to take little mini vacations throughout the year, try to plan for those mini vacations. And then of course, mindfulness. So if you find something that will create the calm sense, so either yoga, maybe just enjoying a cup of coffee every now and then by yourself in the quiet. Also, organizations should have methods that cause managing stress. So finding the right job for your personality and skill, maybe not going for the job that has the most money, but maybe finding the job that makes you feel the best, shows your personality. So match your personality to the job, not the job to your personality. Also, be adequately oriented to the job. So make sure that if you have questions, ask them. If you don't feel like you're ready to go on your own, like tell your leaders, tell someone, so you're not going into starting off the situation, the new job, stressed out. Find employee assistance programs within your organization. Make sure you're communicating and you have social support within your job, because if you feel alone, there's probably other people who feel alone. So make sure you create the tight bond to communicate with. And then also see if they have any stress reducing policies within your organization, like Jennifer said